Now at 4, anticipating a surge in COVID cases as the holiday season arrives. In years past, we've seen a significant spike in cases about this time of year. Staying safe during holiday gatherings, of course, can be challenging. So here to talk about the virus and how to protect yourself, James Mansi, the Vice President of Medical Affairs for Moderna in the U.S. Thanks for being here, James.
Thank you so much for having me. It's a pleasure.
So like previous years, are we expecting a spike in cases around the holidays and kind of after the holiday season?
Absolutely. That's the anticipation. The next couple of weeks, we anticipate seeing the viral load and viral activity increasing as we get into those colder months and entering this fall and winter season. So yeah, we should anticipate those respiratory viruses to increase, COVID, influenza, RSV in the next couple of weeks.
Now, there is another COVID-19 booster that's available this year. How is this one different from the ones in previous years?
Absolutely. So the updated COVID-19 vaccine for the 24-25 season has been updated to be as close a match to what's circulating and what has caused that spring-summer surge that we observed and we felt in July, August, and even into September. And so this updated vaccine is the closest match to that, the variant that has caused that surge, and what we anticipate to be coming into the fall and winter seasons ahead. Much like influenza, the vaccine is updated yearly to be a closest match. Same thing for the COVID vaccine. It's updated to be as close a match to provide that the most protection to Americans and individuals getting vaccinated.
Do we know the effectiveness of the vaccine this year with these strains? I know that with the flu, for example, in other countries, they saw a pretty low effective rate. Do we know anything about the COVID vaccine in that?
We anticipate that this year's COVID vaccine to be effective in terms of preventing these serious outcomes of hospitalizations and even mortality. If we look to what we observed last season, in studies looking at individuals who had received the Moderna COVID vaccine for their last season, compared to a population of individuals who did not get their updated COVID vaccine, we saw upwards of 60 to 64% fewer hospitalizations in the vaccinated group compared to the non-vaccinated group. And this is in a group that were highly exposed and who majority, over 70% of them, had received their previous year's vaccine. So this is protection incremental to what was already in that natural, the highly exposed population. So we anticipate that this vaccine to be as effective and as per the CDC, the single most effective way of preventing COVID-related morbidity and mortality is staying up to date with one's vaccine.
Now, James, we often hear about a COVID and flu shot together as one. I feel like we've been hearing about this for years now. Is that in the works? Is it in the future?
Absolutely. So as we've seen, many Americans appreciate the opportunity to have their shots done at the same time. So this year, the recommendations and many Americans have been getting their influenza and their COVID vaccines at the same point when they're visiting their pharmacist or their healthcare professional. We are, however, working on an updated on a combination COVID influenza vaccine. We should see this in an approval, if all goes well, by the end third, fourth quarter of next year, and that would be for individuals 50 years and above.
Now, I know that vaccination rates are down overall. What would you say to the people who don't think that they need the vaccine?
First and foremost is speak to your healthcare provider. They're the trusted messenger for all your healthcare concerns, questions, and can guide you best. But from my perspective, let's just look at what happened in this spring and summer surge. We've seen tens of thousands of Americans being hospitalized for COVID, hundreds of Americans dying per week from COVID. This is a vaccine preventable disease. We have to stop normalizing disease burden, morbidity, mortality, and start normalizing healthy living, in which vaccines are simply a part of that. We've seen the vaccine to be highly effective in the last season, and we know that even if you take out the acute cases and the chronic conditions, most Americans, adult Americans, over 60% have at least one chronic condition that elevates their risk for COVID-related hospitalizations. When we think about this in practical terms, individuals with diabetes have almost 4.5 times more risk for hospitalization for COVID. Hypertension, 6 times that. Asthma, obesity, 2 times that. And if we take out the acute conditions, remember about long COVID, those long persisting after effects of a COVID infection, such as fatigue, brain fog, cognitive decline, activity, pain. The single most effective means of staying protected and safe is getting your updated COVID vaccine. If not for yourself, then for your loved ones, especially going into the Thanksgiving season when we're going to be together with family members, loved ones, older adults, parents and grandparents, or younger children. The risk to them is equally as significant. And so staying up to date with your COVID vaccine is that single most effective way to keep yourself and your loved ones safe and healthy.
All right, James. Well, thanks for being here today to talk about COVID and the vaccine and, of course, all of the sicknesses to come this holiday season. We appreciate it.
Thank you so much, and I hope everyone has a safe and healthy Thanksgiving with your friends and family. Thank you, Emma.